Hi, I'm Brandy Brimhall, the CEO of Rapid Credentialing. We may have already met at a seminar across the country, or you may have attended a webinar I've presented on the topics of revenue cycle system, coding, billing, collections, compliance, auditing, and things of that nature. I've been speaking on those topics since the 1990s across the country. I'm coming to you today from a credentialing perspective. As we know, credentialing is really the first step in the revenue cycle system process, and so it's important to understand how the credentialing process works and what's expected of us at that level, so we know how then to conduct our billing, because that of course affects all the rest of our revenue cycle system. So I'm coming to discuss with you briefly a commonly asked question that comes into our credentialing office, but certainly it's a very commonly asked question that arises as it relates to coding, billing, and collections as well. And that question has to do with what's the difference between Medicare participating and non-participating, and what does it mean to me? I'm not going to go into great detail on that topic with you right now, other than to let you know that we have recorded a very specific training in our billing mastery training that I have pulled specifically out to share with you following this video. Because understanding Medicare participating and non-participating is so significant for your clinics, not just for the revenue cycle system, of course, but also for the compliance purposes and to be in compliance with the Medicare guidelines as well. So I wanted to pull that out for you because it is a commonly asked question, and there is an impact to clinics for not understanding how they're enrolled with Medicare, not knowing what non-participating and participating means, and what that means to their decision making as they're coming up to the point of deciding, should I be participating or should I be non-participating? Because again, like I mentioned, it matters at so many different levels, and credentialing is that first step into deciding how you're going to be in agreement with a particular insurance company or payer, like Medicare or other payers. We wanted to highlight this particular commonly asked topic today for you, so that you have the opportunity to really understand the difference between participating, non-participating, what it means to you through your revenue cycle system, and certainly what it means to you as you're determining whether or not you should credential or enroll with Medicare as participating or non-participating. So once again, we've pulled this specifically from our billing mastery training to share with you. I hope it's helpful in explaining the details and the requirements as it relates to Medicare Part and non-Part. If you have any other questions related to enrollment or credentialing for your chiropractic, your integrated, or any other type of healthcare facility, we would love to help you and answer your questions. You can learn more about how my team works at rapidcredentialing.com, or you can reach out to us specifically with questions at
So as we begin, I want to just clarify that there are two ways to enroll with Medicare. Before I explain those two ways for enrollment, it's important to note that as a chiropractic provider, if you're treating Medicare patients, you must be enrolled with Medicare as either a participating provider or a non-participating provider. So it's important to note that either of those provider types or enrollment statuses require enrollment. So participating or non-participating, you still have to enroll with Medicare. And there's not a loophole, there's no gray area, there's no way around it. As a chiropractic provider, if you're treating Medicare patients, and by Medicare patients, it's those patients with Medicare Part B coverage, then you must be enrolled. Now, those two ways to enroll with Medicare that I mentioned a couple of moments ago, the first one is really just to go to your local Medicare contractor website and download and complete the documents and submit those into Medicare with all of the documents and the attachments that they need, such as license information, malpractice information, and things along those lines. And you can submit it with standard mail. They'll accept some by fax, but standard mail is the typical way to send that. If you do that, you can simply just send it certified with a signed receipt, and you wait for Medicare to communicate back to you that your enrollment has been approved. And I'll give you some more information on that in just a moment. However, the other method for enrolling with Medicare, which is far faster and easier to manage and really more efficient altogether, is going to be by going to the online portal. And it is PECOS, it's PECOS Medicare. So if you just go and you Google PECOS Medicare, it will take you straight to that portal, and you can click to enroll with Medicare. And there are lots of of different tools on this Pecos Medicare portal that you as providers or clinics can use related to Medicare enrollment, Medicare documents and data, Medicare rules, and various other things along those lines. What you see on the screen right now is just a screen snip of what the part of the homepage of that Medicare portal looks like. And it's an amazing resource, which, initially is for enrollment. And what it allows you to do is set up provider information through the portal, and you can complete the forms and submit the documentations or attach the documentations into your account in the portal, and your enrollment will be processed accordingly. Now, Medicare enrollment takes approximately 8 to 12 weeks for everything to go through smoothly. If Medicare needs additional information from you, they will submit it to you by email. So it's very important that either your online portal email that you've listed, if you go that method, or if you complete the documents, then you have the correct and current email so Medicare can communicate with you if they need to. Be sure to check your spam so that you don't miss an important inquiry from Medicare or a request from Medicare. If they don't receive the requested information in a manner that they have defined, they give you specific deadlines, then your application for Medicare, your enrollment application, will be tossed out and you'll have to start completely over. So be sure to check your email, including spam. The other thing that I would tell you, if you do the paper route by enrollment, then the best thing to do is call the Medicare provider enrollment line that's listed on your Medicare contractor website, and we're certainly happy to provide that to you as well, and request the specific documents, because there are a number of different forms to fill out, or in documents and pages to fill out, and we don't want to no one wants to miss that important information and delay their enrollment, because Medicare enrollment definitely takes a little bit of time as it is. But again, the best way is through the Pecos site. With the Pecos Medicare portal, you're going to also see that they have tutorials. I have a screen snip there for you just a little bit that actually walks you through in just a few minutes how to complete the enrollment based upon the type of provider you are, or what type of practice that you're in. I use them personally all the time when I'm helping clinics, so it's just really a fabulous resource. You can also check the status of your enrollment right on the Pecos Medicare website, which is pretty nice, because if you're waiting to find out where you are along the process of enrollment, you can check and get that information there. So moving on, just in summary, enroll in 2 ways, either by paper, you can get the information and the documents right off your Medicare contractor site, or through the Medicare Pecos portal, which is by far the preferred and recommended method. Next, I want to just share with you related to participating versus non-participating and what that means. So quickly, again, a summary. If you're treating Medicare patients, so patients that have Medicare Part B coverage, because that's where chiropractic coverage is held, then you must be enrolled with Medicare as either participating or a non-participating provider. So while there are several similarities in the participating or non-participating status, such as we must adhere to the fee schedule allowed for that enrollment type, meaning if you're participating, you have to use the participating fee schedule. If you're non-par, you are eligible for the non-par fee schedule, but you may use the limiting charge, rounding that to the nearest dollar, and we'll talk about the fees specifically in another segment to make sure to break that down, because it's a little bit easy to get into the weeds on fees, so we want to make sure to make that as absolute clear as possible. But as a non-par provider, there is a specific fee schedule for you as well. The fees for Medicare apply only to covered services, which means only our spinal adjustment. The next thing, a couple of other similarities. As participating or non-participating, we are required to submit a clean claim in a timely manner on behalf of our Medicare patient, which means patients can't self-submit. We can't say we don't bill this or we're not billing it. We have to submit clean claims for covered procedures on behalf of our patients in a timely manner. As a participating provider, of course, you're the one who's getting paid. That's part of your participating agreement, is you're waiting at the clinic for Medicare to process the claim and reimburse you, which means you're obligated to do the Medicare follow-up and follow through with the Medicare and the supplement or secondary insurance billing. As a non-participating provider, this is where you have a little bit of a departure from, with a little bit of more leniency or latitude as to what you are able to do as far as billing. You must submit the claim to Medicare, of course, in a timely manner, like I mentioned, but on that claim, you may elect to accept or to not accept assignment. And when you go through the Billing Connection CMS 1500 training, you will see the field that specifically relates to is field 27. So as a non-participating provider, if you accept assignment, this means you're going to wait till Medicare pays you and accept that fee according to the non-par fee schedule that Medicare has allowed for your region. If you elect to not accept assignment, this means you're still submitting the claim on behalf of your patient in a timely manner. A clean and payable or processable claim is however it's to be processed. But not accepting assignment means that any reimbursement to be issued will be issued directly to the patient, and they will be reimbursed for the out-of-pocket for the covered service for which they have paid you at the time of service over the counter, which means you're collecting the fee for that spinal adjustment over the counter from your patient. And in this event, you're able to collect from the patient up to you can round to the nearest dollar of the limiting charge for the fee schedule that's listed in your area. And again, we'll break the fee schedule down in a different segment, but just want to make sure that it's clear here. So you can collect for the spinal adjustment up to the limiting charge rounded to the nearest dollar if you're not accepting assignment, and submit the claim to Medicare, and then Medicare, if the claim is payable, will reimburse the patient a portion of their out-of-pocket, not all of it, but a portion for the covered service. And so as a non-participating provider, in summary, you can accept accept assignment, which means you're waiting to be paid by Medicare, or not accept assignment, which means you're collecting from the patient at time of service, and you're directing your Medicare reimbursement is going to go back to the patient to reimburse them rather than you waiting for the money. So that's where one area where non-par deviates. Also, as a non-participating provider, you are not obligated to do the follow-through and follow-up and billing with secondary or supplemental insurances to Medicare. Importantly, those that accept assignment, meaning they wait for Medicare to pay the clinic back, most of the time those clinics do follow through with the supplement and secondary insurance billing because they're accepting assignment on Medicare, so they are following through with any insurance that follows Medicare. The other side to that is those that don't accept assignment and they're allowing the patients to be reimbursed their out of pocket because the clinic is being paid at time of service for the covered procedure, tend to not follow through and follow up with the secondary or supplemental billing because you don't have to. Importantly, Medicare auto forwards a lot of claims, in fact, the vast majority of their claims, to the secondary or supplemental insurance, which means your patients in that event would be automatically reimbursed anyway. So would your office if you're accepting assignment, but you won't have to follow through or resubmit something or call on something if for whatever reason it doesn't. So those are the main differences between par and non-par. The last thing I wanted to really share with you on this is related to covered procedures only. So any non-covered procedure are statutorily excluded procedures like we discussed in another segment. Those you would collect from the patient at the time of service, regardless of whether you're participating or non-participating with Medicare. So in other words, your exams, re-exams, x-rays, therapies, anything else that you do in your office, including products and supplies you may sell to your patients, those are not related to this enrollment discussion, but rather you'd collect at the time of service from your patients, and those fees that you set your own fee schedule for those. You're not required to adhere to any Medicare fee schedule related to excluded procedures, services, or items. So participating and non-participating, like I mentioned, is required one way or the other if you're treating Medicare patients with Medicare Part B. And important to just know what the differences are between the two so you know how to manage that with your office. And certainly if you are going through enrollment, you can make the best decision for your practice.